Lysander Jim, welcome to the show. How are you today?
I'm great. Thanks for having me, Elliot.
Hey, the pleasure is truly mine. And I was just saying to you off air that I'm amazed that we have not discussed back pain in depth on this show just yet. So I'm excited to have you on to talk everything about that world, to dive deep and to really get an understanding of what things cause it, what we should be avoiding in the gym, etc. And hopefully we can come away with a lot more knowledge on an area that seems so well known, but perhaps isn't as well discussed as it should be. But before we do dive into that, I want to give the listeners a bit of context. So can you explain who you are and what it is that you do?
I'm a spine physician. I work out of the United States in the LA County, and I've been treating back pain for about 10 years now. And recently I wrote a book called Specific Spine, which details my kind of first part of my career where I was a standard chronic pain clinician, which our main job is really writing, scripts for painkillers and opioids, and transitioning from that for about the last, almost 7 years now, treating patients with kind of a root cause approach that focuses on the physical effects of how back injury starts and physically how they can heal it in a way that doesn't depend on painkillers, injections, and in many cases, helping patients avoid their surgeries.
Yeah, I like that approach a lot. And what led you to this industry in this world in the first place? Was it always something that you desired, or is it something that came up in your teenage years? What specifically drew you towards this industry?
Well, getting to the healthcare industry was, I think, a few jumps. So first, I had bad dental issues as a child. And then so learning that eating a ton of candy was bad for my teeth was, as a child, a revelation. So I think for a number of years, I stopped eating candy, but there was that sense of it's almost like a miracle. Like you can change just one thing or one aspect that's your lifestyle, and then you can actually kind of fix a problem. So I think that I had this interest in health. I was a runner in high school. I did some kind of weight training, kind of like very amateurish bodybuilding, like the high school level type,
Wow.
where you're trying to look fit. And then those kind of things are in themselves very revelatory and transformational too, to kind of just be kind of make your body healthy. And when I started college, I think I kind of knew I wanted to be a doctor, but I just didn't have any confidence that I could do it because it always makes it sound like the hardest thing in the world. And it is hard, but then it's doable. So about halfway through college, I realized that if I didn't really direct myself toward a field where my love of learning and my love of health intersected, then all this learning I did wouldn't be wasted because I could always apply it to myself, but it wouldn't. A lot of what I learned would be trivia, and so that idea, it just very broadly, kind of led me to just commit to becoming pre-med, then a med student, and from there, I wanted to do a field where I could help people's ultimate health, and then so in the medical realm, one way to define that is based on the idea of function. So how does a person's in any system work? Their joints, their heart, and the field of physical medicine and rehabilitation. It's a field that is generalized based on a functional outcome, and it's not divided by the organ system or the disease. And I love that it wasn't, we use drugs, we use pharmaceutical approaches and interventions, but I like that it had this strong connection to physical movement and other types of rehabilitation and neurological training. And from there, I became a chronic pain doctor. And that was sort of a mismatch for me because I didn't want to treat a symptom. And that's largely what, most chronic pain doctors do. And that's the height of the criticism of the opioid epidemic when I came out of my residency. And so my patients, they were feeling better to some extent, or at least that's what they told me. And, I prescribed these medications safely, but I felt very burnt out doing it. And so there was a local sports medicine doctor who told me about the McGill method and low back disorders, which is a textbook by Professor Stuart McGill, who is a professor of biomechanics and a leading clinician. And in reading that book, it described everything I hated about my original job. It's not focused on root causes. It's overly dependent on MRIs, overly dependent on painkillers. And that describes my professional life. And so if you had told me you can precisely diagnose and treat back pain at a root cause level and help most patients avoid surgeries who had already been told they needed surgery, I would have been very skeptical. But then I just started learning more, taking the courses. I became a master clinician after it was like a couple of years, I believe. And then being able to even diagnose somebody at first felt like that revelation, that kind of miracle feeling like, oh, I was taught that most people can't be diagnosed. and now I can diagnose them. And most of our patients are able to either progress out of their pain with natural methods. And in a few cases, I'm able to direct them to a right surgery, maybe a surgery they hadn't been told they needed. Maybe they've been told you need a disc replacement, but they actually just need, I don't know, like a cyst drainage, or in other cases, they were told they needed a particular surgery, but just didn't trust the original doctor. And I could explain to them kind of cogently, hey, if you don't do the surgery, this is what could happen to you. And so it's a very, I think, a great marriage of kind of all the tools of medicine, but trying to use the most efficient tools first. Sometimes the most sensible, efficient tool is surgery. Many times it's not.
Do you have to go through a lot of mindset switching of the clients that you work with as well? Because I'm sure they're used to going to see physicians like you were at the start of your career who give them pills, who give them immediate pain relief, and maybe you are prescribing a ultimately long-term, much more beneficial approach, but something that maybe doesn't feel as immediately good as just taking some painkillers, for example. Do you have to kind of create that mindset switch? Because it's very similar with the industry that I'm in when it comes to fat loss, right? There's a very, very big temptation for many people to go do this crash diet, to head in a direction where they slash their calories, they lose a ton of weight, but ultimately we all know where that ends up. But if I go down the route of saying, okay, well, we're going to take a more steady approach, but this is going to serve you long term, it comes to a lot of people in a way that's really welcomed, because they're like, I want something to stick. But at the same time, there's also that desire for those instantaneous results that you do get from these more kind of erratic and more short-term mindset ideas. So do you have a tough time with kind of transition the mindset from immediate relief to long-term yet permanent relief?
Yeah, that's a great question. I do think about the patient's mindset a lot in terms of whether they need to be shifted off of a pharmaceutical approach. For people who seek me out, it's sort of a self-selecting process, because we don't take insurance. We tell patients upfront our initial consultation is 3 hours. And we talk about, on our website and other materials, that we're trying to take a root cause approach, and we don't manage your medication, in most cases for pain. And I think that, as a pain clinician before, if I had said to my old kind of patient base, just, hey, don't take this medication, you need this, then you're this gatekeeper you're literally, as a physician, you're a gatekeeper to free opioids. So it's kind of a disjunct. So the people who seek us out, they're not of that mindset. And
Sure.
and a lot of them come in and they said, if anything, they're trying to change the mindset of their other physicians. They go into an area and they say, oh, I'm struggling with a lot of pain. Oh, here's a prescription for Vicodin. And then the patient says, no, I don't want these painkillers. I want to get better.
Yep.
And then the doctor, they said a lot of times their doctors get very befuddled. Like, everyone's trying to, get opioids from me. Like, why aren't you? So in that front, there's not as much of a mindset switch, but the mindset switches happen more in their beliefs about what constitutes good posture,
Okay.
what constitutes good movement, good rehabilitation, how much exercise. I think we get a good number of exercise addicts. They're working out way too much and driving themselves into pain and injury. And so I think the mindset shift is kind of a little bit sometimes away from this really admirable kind of warrior mentality that they bring to their life and their businesses and their personal lives. But when you take that David Goggins approach into your physical approach, and I very much admire him, by the way, but I think as a philosophy of redlining your physical capability, that's actually not the route to health and longevity. And so I think a lot of times, ironically, I think your standard patient population, you have to encourage them, hey, you got to walk more, you got to exercise more. And there's some patients who need some of that encouragement, but the other group, they actually need our discouragement. Hey, you got to, maybe you don't have to PR every week, maybe this approach, like, look at all these like end plate fractures on your MRI, where those come from, it's like, there's a lot of those mindset shifts, and even something as, they think they have the greatest posture ever. And then I'm telling them, no, you're kind of a little bit too erect. You're really stressing your spine in these different ways. So I think sometimes there's definitely this unlearning process of what they learned online from professionals, other doctors, and trying to say, I can prove to you oftentimes that what you believe is actually wrong, because I can take you into that position and increase your pain. So what does that mean to you when that happens? Or I could take you out of that position and very quickly you'll notice, hey, actually I move smoother and I'm in less pain. And so those kind of little insights and aha moments for the patients are very exciting. I can show them. I don't just have to tell them.
Yeah, it's a really interesting idea and concept that you have there because of so many people are willing to take the David Goggins approach. They're willing to red line when it comes to the activity they do, but they're not willing to red line when it comes to their recovery and all the things that they need in order to support that level of training or that level of warrior mindset that they take themselves into the gym to. Because of when you look at an athlete, for example, they look like they do a ton of activity, and that's because they train twice a day, etc., etc. But you don't recognize that outside the time, the 2 hours a day, or 2 hours in the morning, 2 hours in the evening that they're spending in the gym, they're doing 2 hours in the morning and 2 hours in the evening of recovery work and corrective work. And I think that that's the biggest discrepancy that people, especially the general population and those who are leaning towards being passionate about the gym, but not actually athletes per se, have the issue of, is that they're willing to put those 3 hours into their training, but they're not willing to put the 3 hours into the recovery. So when people ask me, is there ever such thing as overtraining, I prefer the idea that it's probably more likely to look like under recovery versus overtraining. So I like that concept that you mentioned as well. And I think that we're just missing that ratio as well. So coming into back pain, that's a very generic and broad term. How do you go about diagnosing it and categorizing what back pain truly is? Because of a lot of times we hear back pain, but a lot of this is originating in the hamstring or is originating somewhere else in the body. So how do we know what back pain truly is?
Back pain is usually defined as pain in the kind of back area. If we're talking about low back pain, it would be kind of between the lower ribs and the top of the glutes. So usually it could be pain in that region or pain arising from damage in that region. So for example, sciatica, it doesn't hurt necessarily in the back but it's a nerve that's being maybe pressed by a disc bulge that's then shooting pain there.
Sure.
And in terms of knowing, I mean, that's a very foundational question. Like, how do you know something is back pain? How do I not know it's a leg pain? And then so the clue is usually in the pain pattern. And so that's a combination that I think your doctor usually figures out by a medical interview. Oh, when did it start? And where does it hurt? What makes it better? What makes it worse? Versus, and in addition, there would be the physical examination. Well, let me check your knee. Maybe let me check your hip, and I'll check things that relate to the spine and nerve tension. So then you're kind of converging on the structure, for example. And the reason it's such a big deal is when somebody has a back pain, there are literally dozens, if not hundreds, of causes that can cause back pain. So we've seen back pain cases who had blood clots in their lungs. The lungs are kind of generally in the back area or close to it. We've seen people with gynecologic issues like ovarian cysts, uterine fibroids. We've seen people with hip injuries too. I actually saw a child recently who they had a cartilage injury, a very severe cartilage injury. And then so all of these things could be mistaken for back pain if the clinician isn't thinking about it. And it's by no means obvious oftentimes. And in my field of PM&R, physical medicine and rehab, we often talk about when you have pain in a particular joint, you often have to think about whether that pain can be originating from a nearby joint. So if you have back pain, maybe look at the low back pain, thoracic spine, and maybe the hip. Maybe you sometimes have to go down to the knee. And so we've seen multiple of these presentations that can happen in addition to their back pain that they have, or it's actually the whole presentation is a hip pain problem that looks like a back injury.
Yeah, that makes a lot of sense. So some deep analysis has to be done in order to actually correct what is going on and not just where the pain is originating from, essentially. So I like that approach a lot. And when it comes to what causes back pain predominantly, I think that there's some ideas that we probably know about. So can you go through some of the most common causes of back pain and some of the things that might surprise us that usually are the culprit?
The most common cause of back pain is some form of disc injury. And the surprising thing about disc injury in general, at least in the initial period, does not hurt at all. And so that's often very surprising to people. And it's been proven over and over. I mean, that type of study is easy to do. You collect a cohort of patients who've never had significant back pain currently or in the past. You get an MRI of their spine, and lo and behold, you'll see a lot of them have disc bulges. And so that creates a lot of confusion for both patients and clinicians. Well, why would a disc get injured and be bulged but not hurt? That's one of the central questions in our field. And the answer is actually rather simple, but it took me years to formulate how to express it simply. The disc is one of the largest structures that where most of it doesn't have nerve endings. So just like when you get to trim your hair or cut your nails, these tissues are living in a sense that they're growing and they're not fully dead. And the disc is very much an alive tissue, but because it acts as a spacer and a pressure chamber of sorts. So when you get load, that disc gets very turgid and high pressure. It actually is a hostile environment for little blood vessels and little nerve endings. And so if somebody, let's just say, tears the outer wall of the disc or, creates a bulge because they're bending around too much, it actually often doesn't hurt. It only starts to hurt once it starts to impact a tissue that does have nerve endings.
Right.
So for example, the tops and bottom of the disc are called the end plates. It's a very thin area of, it's about the width of a scalpel's blade. So very narrow area on the top and bottom of each disc. So if those areas get damaged, then you're going to feel pain. Or the classic one most people have heard of is sciatica, when that disc bulge protrudes far enough and hits a spinal nerve in the back, then that's the onset of gluteal pain and sciatic pain. Another kind of leading cause of these pains are what we talked kind of briefly about end plate injury, which is the top and bottom of each disc. That's the structure that is rarely discussed, but it's actually it's the most vulnerable part of your disc and one of the most vulnerable parts of your spine. So if I describe this injury mechanism, let's say the person doesn't have pain going down their leg, so it's not, let's just assume here it's not sciatica, but they just put too much weight on the back squat and then they felt their back kind of pop and go out and it feels sore for the next few weeks and months. That's probably some degree of end plate injury. It's really what are the tissues that are getting loaded with that particular movement. And usually the weakest one is going to give out, or the one that you stress too much is going to give out. So I think that another group of injuries, we see these in certain types of athletes like gymnasts and baseball players, wrestlers, is damage to the back of the spine, the bone in the back of the spine. So one of the names is spondylolysis, or spondylolysis, which is a fracture of a ring of bone behind the vertebral body. And the reason that these injuries converge into these different fitness groups is you have to have a certain type of body to do certain types of sports.
That's true, yeah.
So then including your spine. So a gymnast, for example, a baseball player, they're going to have a decent amount of rotational movement in the spine, which is actually helpful for their sport, but it also predisposes them to certain types of injury versus an NFL lineman who there's like a forward and back force. So they don't have to rotate very much, but if their spine can't take that forward and back force, they're going to get into back pain pretty quickly. So I think so then the surprising thing is sometimes the gift you have that allows you to do that thing, it comes associated with a vulnerability. And then that vulnerability is sometimes increased because then when you're in that special group, if you're a gymnast, you're going to do way more bending than the average person who's a couch potato. And so your risk of that injury actually goes up much higher than if you didn't do that special thing. So I think that one thing that's very difficult for people to reconcile is to realize that a lot of competitive endeavor comes with a lot of high risk of injury. People in the field kind of know that jiu-jitsu players are always talking about their neck and their spine and their knee injuries now with all the leg locks. And then the weightlifters, they have their own, they're very scared of disc bulges. And then these other athletes have their kind of slippage injuries. So I think everything is clustering because of the unique body and the excessive loading people are putting in. And I think that might be surprising to a lot of people is that injuries are actually predictable.
Yeah, absolutely. And it makes sense that people kind of have this awareness that sport can be on the outside looking in. When you look at someone's body or the movements that their body can do, for example, it usually looks very, very healthy. And you're like, he's an athlete, he must be healthy. This guy's got a six-pack, he must be healthy. But the reality is actually when you look beneath the surface, the activity that they're doing or what is required to make sure that they have that six-pack, if they're not genetically gifted, and there will be the genetic outliers who can just handle, and we see it all the time. There's one football or soccer player who's injured every 2 weeks. And then there's this other guy who plays endless games and never gets injured. And I think there's obviously a genetic component there as well. Maybe there's, interventions of how they look after themselves factored in as well, but probably a big genetic component too. But yeah, I think realistically, it's quite a common misconception that the people who look healthiest, who are able to do these amazing things with their body, actually causes them the most harm as well. But I want to take it away from the athlete population for a second and bring it back to the everyday gym goer, let's say, or the person who's maybe just doing some exercise from time to time. You said the couch potato as well, because those are the type of people that come to your mind. You don't think of the athlete with the back pain. You might see them injured, but you think of the guy who's maybe a little bit overweight and every time he stands up from his desk, he's holding his back. Or you think about the person who's maybe an intermittent gym goer who's coming away and saying, okay, I'm out again because of this back injury as well. What's causing them to have those issues with their disc bulges, and what is leading them to ultimately being out of action for, weeks at a time?
I would say the general answer to that is usually most of these type of back injuries are physical injuries. So they come from too much bending, too much twisting, too much loading. And then that word too much is a very fraught term because it's too much for that person and their spine. And maybe they could have done it when they're 20, but they can't do it now. Or maybe they did too much in their 20s and now they're 60, and there's going to be certain consequences for earlier overload. Sure. Just like you use your hands too much, you load your hand too much, for 20, 30 years, don't do anything for 20 years, you can still get pretty bad arthritis at the end of it. There's sort of this joint tissue muscle memory. There's kind of that, it's your overall health is kind of like a legacy of all your genetics with everything it interacted with in the past. So I think the big question, I think the key insight about why people stay in pain is they are either bending, twisting, loading their spine in excess of what it can currently tolerate. And most of the time, this is unwitting. For example, when you use standing, for example, I have some people, they say, I hurt when I get out of bed, or I hurt in the morning. So I'll ask them, well, just let me slow you down there. So when you open your eyes in the morning and you're laying in bed, are you in pain already? They say, no. And then I say, well, when do you feel pain first? They say, well, it's immediately when I stand up from the bed. And I say, right that moment? They say, right that moment. So that cues me in, hey, that's probably an instance of how they're standing. Maybe they're locking out their hips too much and extending their spine. Or another pattern might be, no, I stand up, I'm fine. But it's just as I stand and I do my morning things, very slowly it starts to creep up. It's not that sudden onset. So then that tells you, okay, maybe there's some sort of accumulation of something. It could be, well, because they're bending a lot to, wash their face and, do their toiletries. And so those different pain patterns kind of suggest types of injury mechanisms. And then you can kind of further refine that by saying, well, where does it hurt you when you say it hurts you in the morning? Is it down the leg? Is it in the back, etc.? And then those other clues can give you this roadmap of what's causing you pain. So if you have the roadmap of what's causing you pain in a very precise way, then you can actually build the roadmap out of pain in most cases. And I think some of your listeners might be thinking, well, what if everything I do, it hurts very severely, and no matter what I do, it hurts? I would venture to say that's rarely the case. And if it is the case, then you may have what's called a red flag condition. So red flag conditions could be a spine condition that's just so bad that no matter how you change your position, the loading doesn't change much. Maybe it's a bulge that is just pushed all the way back into the spinal canal, creating a dangerous nerve compression. Or it could be a blood clot to the lungs, or it could be, sadly, we've diagnosed a few cases of cancer or lymphoma that's infiltrated the bone in the sacrum. And then you'll get very bizarre pain patterns there where maybe they'll come to your clinic and say, I have no pain at all. And then I'll do every loading test and they'll have no pain. But they say, but it hurts tremendously at night and I can't escape that pain at night. But I couldn't create one uptick of pain at all on the exam. So when I saw that person, I said, I'm very concerned about this. You really need to scan much more of your body. This could be a cancer or other presentation that we're missing. And it, sadly, it turned out to be what was very rapidly fatal lymphoma in that elderly man's case.
Wow. Yeah, it's insane of how these things can develop and how when they're not diagnosed, they can lead to, like you said, fatality ultimately as well. So it's definitely something that we need to be aware of. And the question that came to my mind, and you mentioned it was kind of subjective as well, is how do we know what is too much? And the biggest challenge here is, like you said, maybe it wasn't too much in my teenage years, but it's too much in my 30s. Maybe it wasn't too much in my 20s, but it's now too much in my 50s. I imagine our ability to tolerate load, the amount of bending and twisting that we do, essentially, I think I heard an analogy recently. It's like if you open and close a kitchen drawer, it's not going to be as smooth and efficient as it was the first time you did it, the 1,000th time you've done it. So how do we kind of know where we're at in terms of the longevity and essentially the resilience that our spine has when it comes to all these day-to-day movements that we go through?
The guiding sign is pain. And pain, I'll describe it briefly because sometimes some of the patients will quibble about me. Well, what is pain? What if it's an ache? What if it's a discomfort? What if it's, as like, okay, it's all pain. It's just, what is pain? Pain just described in the kind of medical term is just, it's some unpleasant sensory stimuli. And it could actually be physical or mental. But then, so I think that using pain as kind of the North Star of what's bad for you and what's good for you, it often works. It usually works better for what's bad for you. So if you do an activity, so the question could be, well, if I'm doing a sit-up and it hurts my back, shooting pain down my leg, then that's proof that you're probably stimulating your pain trigger. You're hurting yourself more. But then sometimes people come back and say, well, it doesn't hurt when I do the sit-up, but like 2 hours later, my back might be more likely to go out. So that too is kind of another indication of, that increased sense of fragility or the pain itself. And so sometimes people will say, hey, I have these like step counters. I noticed if I walk 500 steps, I feel great. But then the next day I increased my step count and then my back went out. So I went back down and I worked my way to 500 and then and beyond, and then my back went out again. A lot of times what that indicates is one is there's this misunderstanding that if you're not in pain, then your back condition is you're free and clear, but you're not free and clear. When your pain winds down, that's a good thing. But the healing, that robustness that you need, it actually is a largely a silent process. So it's kind of like the absence of pain with your, postures, movements, activities, exercise. So then I think that that's often how we guide patients, and then that's using pain in a very specific way. So I think you can use pain as a challenge to yourself. You could say, I have pain, and I'm going to push through this pain because I'm tough. But when it comes to spine rehabilitation, that's one of the worst things you can do, and that's actually a shock to some patients. They just have this general. It's almost like a life philosophy. I'm the kind of guy or gal. I push through things, and then it's just like, well, in this domain, that's keeping you in pain, and then they say, oh, actually, yeah. Now that you mention it, yeah, my stretches do hurt, and this therapy or that therapy does kind of hurt me too. And then I say, yeah, there's a reason for that. Like your spine is telling you it doesn't like it. Just like when you touch a stove, why do we have pain evolutionary? It actually, it alerts us to there being harm to us. And then so we kind of ideally withdraw from it. We don't try to lean into it.
Yeah, I think that's a really good thing for people to think about. It's just more of an indicator that something might not be right here. And obviously we don't want people to run away from the first signs of pain, but if it's chronic, if it's super intense, because if realistically the first time someone does a deadlift, for example, they might have some lower back soreness because we have muscles in our back, right? So the natural soreness we feel is not necessarily because deadlifting isn't for them. They might do it in a perfect way, but they just feel a bit of soreness in their erectors and their lats because they haven't contracted them like that in 10 or 15 years, for example. But it's when it becomes chronic, it's when it becomes intense, or maybe like a shooting style of pain. That's when we should be more aware of it. Am I correct in saying that?
I would say it depends. I mean, the discomfort associated with using something, that's not necessarily harmful. I have patients tell me that when I teach them, well, this is a better way for you to stand. They say, oh, it's funny. I feel like my calves feel a little bit sore on both sides. So then usually if it is distinguishing between kind of just use muscle soreness, it should be mild. And I think in almost every case, it should be mild if someone's being progressed appropriately. I think so a little bit of that is okay, but I think there's some ways that people can think about it. One is usually with back pain, you have primary symptoms. So meaning it hurts in a particular place or region, and it hurts in a particular way. So with your activity, I think the clear sign is it provoking your primary symptom? And I think like what you're matching and if there is a discomfort, is it the regular use discomfort, which I think most of your clients know about, or is this in an expected region for that load? So I think that it takes a bit of discernment in terms of figuring it out. But I think the good trainers are always kind of cognizant of what's real use kind of discomfort and what's I'm putting the person in pain. And the bad trainers I see, they just keep pushing their athlete further and further into pain.
Yeah, for sure. I think it's really important to first understand the distinction between the two. And then after that, be very, very aware of your limitations, your capabilities, and also the progressive nature of things as well. I think that there's always this temptation to rush into things or load up too quickly. I think that's a big thing when it comes to the industry that I'm in. There's always this temptation to lift heavier and to do more and to kind of break and bend ourselves in different ways when realistically, I don't think that I think that's maybe a big missing piece of the puzzle when it comes to training is longevity. I think a lot of us think, okay, well, how's the session going to go today? Not, will I still be able to do this type of session in 20 or 30 years? And I think that's probably, the root cause of the majority of things in life is not thinking about how our actions today influence our actions ultimately 20 years down the line. But I think that's a big one when it comes to the training side of things and longevity as well. I think that's a mindset switch that I've had. I was training since I was about, I want to say 14 to 15 years old. So I know that I've already done a lot more training than, if someone starts in their 30s, by the time they get to 45, I've already done more training than they have. So I need to be aware that I'm going to train through my 30s and my 40s as well. So I've already done a lot of the load that some people would have done in their lifetime. And so I have to be aware of that when it comes into moving into my 30s, etc., in regards to what can I cope with now based on the fact that I'm already 15 years into this training journey as well. Is that something that most people should be aware of as well? If they maybe did a lot of sports at school and they went all the way through their early adult life, as someone who did a lot of training or a lot of sport?
Oh, absolutely. Because if you did a lot of training in particular ways, then there's already some mileage on certain tissues in, it could be your back or your other joints. And then so maybe people when they're younger, they have a performance domain. They had to be a good baseball player. And then so the demands they needed for that sport are very different from the demands they need now as, maybe like a middle-aged family man, who's, running a business or something like that. So it's, yeah, you kind of want to think about why you're training oftentimes, because you're absolutely right. What's the point? Let's say you could train me for the next 2 years and get me into the best shape of my life. What's the point if I stop training at the end of the 2 years? Or if I eat well for the next 2 years and then I'm a slob afterward. I think it's really the consistency that kind of brings the long-term results and the magic in the long run. And then so with, let's say somebody is in their, I don't know, 60s or 70s or beyond, the first thing I tell them often is, they're focused, they're here for their back. And I just try to tell them, well, what's the number one thing I can do to help you? I'll just kind of quiz them on it. And then they'll usually, have some answer. And then I'll say, and almost no one gets it right, but the first priority is actually to prevent a fall. That's one of the leading causes of death in that patient population. And so some of these people, they're very their movement is actually very degraded, their balance is very off, and others will have very smooth balance and motion. But even for them, I'll tell them, well, if you have this beautiful rug in your living room, that's a liability. If you have pets, don't get rid of your pets, but you got to be very careful about if they're underfoot and how you're kind of moving around when you're near them, because they're a frequent cause of falls and injuries too. So I think it's kind of that PM&R background kind of kicking in. It's just like, well, what do you really need to be kind of healthy in kind of the full physical sense? And that may connect to metabolic things. Like sometimes patients will come in and they're so cardiovascular deconditioned. Their blood pressure is high. They're huffing and puffing after, a 10-second plank or something. So I'll tell them, it's like, well, you're going to be limited by this until you kind of get your blood pressure under control. And as you know, the leading cause killer in our most developed countries is heart disease. So then you really want to not, want to put the main things first. And so I think that when you kind of think about when I try to think about what I educate people on, there's certainly a whole universe of healthy things that a person could do, but really what's most relevant is what's going to have minimal risk and what's going to give you the maximum kind of benefit for your situation. And so what do we really need? We really need to stay pain free. We need to be able to, be good parents and partners and etc. And then we want to kind of have sound body, sound mind. That's really most people. but I think the way they're training, it's almost like they're secretly preparing for an underground cage fight or something. It's like, are you getting so big and strong and you're rolling 4 times a week? So I think that's why people probably responded to Fight Club. People laugh at Fight Club and how extreme it is, but I think a lot of people secretly have that,
Uh-huh.
they're like, there's like some sort of demon that they're exercising. And yeah, I just try to point that out to them. And it's not always a well-received
No.
message, but hey, it's just like, I'm here to tell you the truth, not to tell you what you want to hear. And people kind of bargain with me like, well, if I do this, can I do this? And can I do this? It's like you have to bargain with your biology. I'm just a messenger based on what I know. I'm not always dead on about what you can do, but even if I'm wrong, let's just say I think your limit is here, and I want people to train under the limit. You can't kind of redline things. So then even if I undertrain you to some extent and you're a normal person, then you're actually going to win. But if I overtrain you, you're going to get hurt, and then you'll be worse off than if you were a little bit undertrained. And so even the athletes will say this. They'll say, if you actually overtrain, that's way more dangerous than if you undertrained a bit, because then you've broken yourself down, and then now you have to compete.
For sure. And you've got higher risk of injury as well. And what's the most important thing? Like you said, the most important thing to an elderly person is to not fall. The most important thing to an athlete, yes, it's high performance, but it's actually being able to perform because you're not injured. Because if you are injured, you can't play, or you can't fight, or you can't do whatever sport that you are competing in. So I think that's a big aspect, is like you might feel like you're getting a little less of an advantage by not being in the gym for 7 hours a day, but just by toning it back a little bit, you are actually able to perform at your very best. Like you said, you're going in rested and you're kind of at that peak capacity without going overboard. And I like that idea of mileage as well, understanding that we do have a certain amount of mileage. And, if we are people who have exercised early stages of our life, then we might have worked through a lot of that mileage already. So we've got to be aware. And also, as you said, we go through different seasons of life. Like when I was a lot younger, I would have been more than happy to go to the gym 5 or 6 times a week. But A, it's just not practical now. But B, if I wanted to do that, I don't think that I would be training in the same way. I don't think my body would be able to take it the same way it would have done 15 years ago. So I think it's really, really important to reflect on, like, what are you doing this for? And like you said, a lot of people are training for that underground cage fight without really realizing it. So I really like that. So let's take it to the gym. I think a lot of my listeners would be really interested about certain exercises that are essentially ones that you would encourage people to do to protect their spine, to keep them functional, to keep them healthy. And then maybe other exercises that in your eyes are maybe no-goes. I'm sure this is all context dependent, but if you can keep this as broad as you can, but without giving us too many like absolute black and whites.
I'll start with a couple of general principles. So then the spine, unlike your other joints, you exercise your elbow, your biceps. What do? You take your arm through a range of motion. You put some weight in it, and then you kind of bend it through. The spine works from a different principle. It actually likes to work most and is safest as a stabilizer. So the kind of prototypical spine exercise in the old age, it was a sit up. Sit up is to kind of give a harmful example. You're actually taking load, you're bending your spine, so which puts a lot of stress on the disc. So it's actually a great way to create a disc injury. So what's helpful instead is exercises that are more in the isometric pattern. So meaning your other joints might be moving. So when you're in a plank, you get into the position and nothing moves. You're basically resisting a type of force. So a lot of the best exercises for the spine are isometric. So a very easy one is, for example, band hold. I'm just standing there, I just pull a band hold, pull elastic bands down and hold it. And so that's going to be a core challenge, not just an arm challenge, because you're thinking, well, my arm is stabilizing it to me. So, well, what do you think stabilizing your arm? So your core and your trunk and your legs.
Mm-hmm.
So that's an easy one that some of even our sickest patients can do. And then certain types of planks, there's a lot of variations. On a wall is very easy, and you can make it infinitely hard. On a bench is a bit harder. On the floor is yet harder. That's another series that some patients do. In general, the ones with the best risk-benefit analysis is so-called McGill Big Three. And so these are the bird dog, which is an exercise that's done on all fours with an arm, an arm and or a leg out, the side plank, and an exercise called the modified curl, where somebody's in kind of like a sit-up position with one leg bent, but then they kind of they're rising up through the sternum, so the mid back, and just holding that position. The low back doesn't actually move. So those are on average, the three high yield exercises that are safe for many people, except the particularly sick.
And what about specific quote unquote lower back strengthening exercises, like when someone goes on a hip extension and they go and they get into that position where they're looking to really contract the lower back? Or another one that comes to my mind is potentially something like a deadlift where someone says, okay, it's going to strengthen my lower back. Fantastic. And maybe even something like a Superman, for example, as well, where you're lying in a prone position, you're lifting up your arms and legs in order to contract your lower back. What are your thoughts on those specific exercises, and should we be looking to try and strengthen our lower back in those type of ways?
I would say for the average person, no. If there's a special performance demand in some of them, like a squat, a deadlift has a role for certain types of performance domains. And then to Supermans, we would almost never advise it because you're taking your spine into what's called an extension bend, where your spine is arching and you're doing it under high load. And usually that exercise, it's when you think about what's the benefit from doing it, the benefit is not necessarily there the way it could be for a squat and a deadlift done properly. But as you described it with kind of that lockout mechanics, I think you were it's almost to me like an extension question. Can I lock out and arch my spine at the end? That's a very dangerous thing to do. That's actually a great way to create injury of your discs and of the neural arches. And that's one of the primary corrections we have to help our patients with is even when people don't know this, but when they're rising from a chair, if they do it properly, that's actually a squat.
Yeah, that's very
so
true.
Then when that patient I talked about earlier, who they're kind of getting up from bed and they're having that pain right away, that zinger, it's usually because they're locking out. So I think that the extension question you asked is extremely insightful, because I think that is probably the most overlooked postural and movement error that's actually driving many people's pain based on the patients we've seen. So it's rare that a week goes by where we're not correcting that.
Yeah, and it's amazing because you'll look around in the gym today and you're at least going to find one or two people doing those type of movements. It really won't be a surprise to you whatsoever. So I think there's a lot of educating to do, and I think the challenge with the gym is that majority of people believe that, if my body can move in this way, then I can go about and train it in this way. And the biggest issue I have, and the things that I say to a lot of my clients is that, and this is probably going to be the last section of this podcast in regards to posture, is that already your posture is not in a favorable position, and you've done a lot of wear and tear to your body through the twisting, through the bending and everything along those lines. And now you're going into exercises which you can't necessarily maintain a good posture, and now you're loading them. And that tends to be the challenge. So that's why, we need to be wise about not just throwing you under the bar and doing a barbell back squat from day one, but maybe a goblet squat or even just a bodyweight squat to a box to begin with is probably going to be more advantageous. And they're like, well, where's the intensity? And it's like, once again, the intensity cannot really be there until we know that you're moving in the correct way. And I think that that's, again, some of the mindset thing that I said to you at the very, very beginning of like making sure that people are thinking longevity, they're thinking about long term and not short term here, because the temptation will be just to go under the bar like we did 20 years ago in squat. But ultimately, we know what's going to happen there. And something that comes to my mind when we speak about the squat as well is another thing that a lot of people experience, which is the butt wink, which is what is commonly called. Yeah. And where kind of your lower back kind of rounds over. It's not a very pretty looking thing when you actually see it within a squat pattern as well. But basically, you come down to the bottom and then it kind of rounds over, and then you kind of do that reverse as you come back up. Talk to me about the butt wink, why that might be problematic. Is it problematic? What is your thoughts on that?
Oh yeah, the butt wink is very problematic. So it combines two of the worst things for your back. So bending your spine, if it's low load, you can safely do it if your spine is healthy. And taking load, your spine can safely take on a decent amount of load if your spine is in its neutral position. But so there's this concept of power. So power in the physical sense means it's kind of a thing that relates to kind of movement and load, right? That's kind of the combination. So when you have a load on your back, you're like a back squat, your spine's already loaded. So then the safe way to perform that movement then is to make sure that there is no movement through the spine. So if you go so deep into your squat that because of technical reasons or your anatomy is limited, your hips are tight, that you kind of have butt wink is really just a bend of usually the lower spine, L5, S1, L4, L5, that lower mobile segment. And so that's one of the quickest ways to create a disc bulge, a disc wall tear, and a number of other injuries depending on the load. And so that's partly why, I mean, I think it connects to your earlier point where people look for intensity, but what you're trying to cue them on is technique and movement quality. So it's almost like you have to earn the intensity, and you earn that intensity by proving that you can move safely. And even then, of course, no matter how perfect your form, there's a range based on your fitness, your prior mileage. And I would even say prior mileage, I would actually modify it to say it's not always just a negative thing. If you train sensibly when you're younger, you actually have increased your capacity for life. Your bones are denser, your joints are stronger, your muscles are actually more adaptive. So those people who used to be jocks who kind of let themselves go and then train again, their gains are always faster than the person who's a lifelong couch potato. So then I would say it's some of our early, as a runner, I think I never tested it, but I'm sure my leg bone density is way better and my lower body musculature is way better than if I hadn't kind of done that activity earlier on.
Yeah, I love that point you said in terms of earning intensity. I think that that's one big takeaway that I want people to think about today, in the sense of, okay, it might not be as intense as you would like it to be, but there's other ways to create intensity in a far safer way. And like you said, you have to do that risk reward ratio as well. And I think as much as we can minimize the risk and do everything that we can to maximize the reward, like those are the exercises maybe where we want to go hard in terms of intensity, and those other ones where the risk is slightly on the higher end and the reward is, somewhere there or thereabouts. That's where we've got to just kind of check ourselves for a moment and just determine what we're going to do with that exercise in relation to our long-term goals of actually staying healthy and being able to stay in the gym as well. So something I now want to transition onto is posture, and that being one of the biggest talking points just about in any walk of life, whether it be your confidence, whether it be your gym performance, whether it be, walk into an interview room, for example. So I want to get started with, what do you deem as good posture?
Well, good posture is something that you discover rather than you impose on yourself. So what that means is people have, I think nowadays it's safe to say, a lot of times we have the wrong models. I mean, a model for a lot of young men was maybe the Liver King, right? Before all the stuff that follows. And then so I think that's your conception of what health should look like. But I would say good posture is, let's start with the spine. It's generally a spine position that does not increase your pain. Ideally, it could be pain-free if you don't have any injury. For the healthy spine, it's really very closely synonymous with what's called the neutral spine. It's the position where there's no special tension on the ligaments, the discs aren't especially loaded in any direction. And in that middle ground position, it actually is its most resilient. The muscles are oriented in a certain way that gives it the most leverage. So it's almost like almost all of these great effects are present in that position. So I would say, hey, you have no back pain. Just learning what your neutral is going to kind of help you stay pain-free. But then it begs the question, well, what if I do have an injury, and what if my neutral hurts me? So I would say two things. One is, often the times what people think is their neutral is actually an extended spine position. So they're arched, but they think they're neutral. And then they're like, well, my shoulders look a little bit rounded. That means I'm not in a neutral. But maybe that is your neutral. So there's a little bit of rounding. And then so kind of this connecting those two concepts. For some people with back injury, it's somewhere away from neutral a little bit might be helpful. So if someone's very kind of forward bend intolerant or so-called flexion intolerant, their ideal for a time might be a little bit extended, not too much. Or for a patient who has so-called stenosis, spinal canal stenosis, a little bit of roundedness or flexion actually might be a safer position for them. So it's really, so as you can see, I have to find that, and it's really determined by what ramps up their pain and what can they move efficiently in and minimize kind of those factors.
How much does technology and trends influence these issues? Because there is a lot about having, this nice, well, not nice, but this rounded spine. So you're sticking out your glutes a little bit. Maybe if you're a woman, lifting up your chest higher, if you're a man, or even potentially going through some type of surgery and getting bigger breasts, for example, where, that load is going to be a lot heavier. How much is technology and fashion and trends influencing our posture compared to how it did maybe 30 or 40 years ago?
Well, when I was in college, I used to give presentations at the Children's Health Museum in Berkeley. And we would talk about, one of the topics was body image issues and the rise of bulimia and anorexia. So I think that it's, and back then, what did people have? Like TV commercials to kind of, pollute their minds. Social media is much more insidious. And I mean, I think men and women are very vulnerable to it. I mean, you get, back then there's been a lot of female cosmetic procedures. Now there's those procedures where men are injecting kind of muscles or tissue to give themselves big pecs. So I think that where my appeal and my kind of drive to become a doctor was really more focused on the health aspects, really more than the performance. And there's certainly some connection between those two, but I think it is harming us. I mean, people don't really need to look so shredded and great, if you're like a guy or a gal who wants to look very fit to be healthy. And there's always these kind of memes about how certain kind of even like high performers, like athletes like Nikola Jokic or Tyson Fury, they're like, oh, these guys don't look that fit. And then it's just like, well, they're not, that's really not what that performance domain is about. So I think people have confused ideas in general about even just performance, like what's very high performing versus who looks like the baddest guy in the room and who really is the baddest guy or girl in the room. Many of us have the wrong models and heroes is kind of a statement I heard someone say the other day. It's like a lot of us have the wrong heroes. So then so this looking a certain way is actually one of the junk values. It focuses on the external, it focuses on the superficial, and then a lot of the understated thing, I think some social media people are talking about it, is for some people, their idol is a movie star with, who got very shredded all of a sudden. And then there's a good chance that some of them at least are using performance enhancement that used to be purely the domain. So then the idea of how a person could look and look what looks good isn't always what's healthy. And then when you kind of see how the sausage is made, I mean, I think there's this idea of sports purity, right? With the whole Lance Armstrong, to use a kind of like an outed example. And everyone wants to kind of criticize him. But what's healthy about riding, I don't know, a few thousand miles in a month, across the mountains? It's not a healthy endeavor to begin with to say, and I think he probably wouldn't say it, but it probably is healthier if he did some amount to sustain it and to recover than if he didn't. Like just doing that thing is actually, is considered this monumental human feat. So to your listeners, I'm not promoting doping, but I'm just saying that what we want, it's almost like we want everything, right? We want this person to be the most elite, do it at all costs. And then when they do something that kind of supports kind of to feel that, then we're saying, well, that's not healthy. But this whole domain is generally not that healthy. And so you have to think about health versus performance. They're very different things. And an elite performance, where you're willing to do anything for that 1%. And I think some of the things that they do, it's giving them way more than 1%. So you think they're going to do it. So I think that it's like, there's like this kind of wishful thinking that people have about all of these different things. So if you're a regular Joe and, just work out enough, you don't have to look like Cristiano Ronaldo, right? And you won't anyway, because he has God-given genetics. He trains all the time, and so he, it's really, some people just have, amazing physical and other genetics too on top of that.
Yeah, it's wild because I did physique-based sports like 7 years ago or so now, and realistically, a lot of that came down to maybe vanity and aesthetics and all that other type of things. But realistically, I probably got more attention when I trained a lot less and I was holding a little bit more body fat. And I also wasn't only interested in the gym and eating well. I actually had some more interest in the outside world. So what we actually think will get us what we want is not always actually what we will want, as what we're going to get. Because realistically, the guy who thinks he's going to be better looking and more appealing to the opposite sex if he's got 5 kilos more of muscle, actually, when you go out into the real world and ask the woman or men, whatever your preference is, what they want, they actually just want someone who's kind of just streamlined and in relatively good shape and is, open-minded about other things other than just how they look. And then the same for the woman as well. The woman who's got her spinal issues because she's sticking her butt out 2 inches further. If you put it in by 2 inches and just kind of developed being more of a well-rounded person, you would have just as much attention from all these other guys. So it's insane how we look at these things and we think that, it's the answer to our challenges. But realistically, when we take a step back, ultimately what looks into our complete health usually gets us what we want. And we're going to take a sharp segue because I do have this question, which I'm very, very curious about, which is hanging. Hanging from a bar seems to be more popular than ever. And it's weird that something so unsophisticated and maybe quote unquote simple has gotten so much attention recently. You hear people talk about it all the time at this moment. So how beneficial can hanging just simply from a bar be for our posture, for our back pain, for our shoulder health?
I would say that depends on the fitness and injury history of the individual. So hanging is valued because it's a decompressive kind of load. And I think sometimes you'll see certain trends like, inversion boots, hanging, they're all kind of things that kind of pull and stretch your back out. And for certain types of injury mechanisms, it actually is helpful to hang. But then there's a lot of ifs, like, so if your shoulders are strong enough to deal with it and your grip, you want to think of the whole chain. Are your hands strong enough to really hang? Your elbows enough to take that pulling force? Your shoulder strong enough? Is your spine strong enough to take that pulling force? Because if you have a lot of injured patients, they actually have some degree of what's called instability, that joint level that's injured. It's kind of slippage. It kind of can slip and even dislocate in some cases. So when you have a traction force, that actually pulls your disc apart and makes an instability injury more likely. So I think that if you're not that conditioned, it actually probably isn't that safe. You actually have to earn hanging too, with kind of like a holistic type of training. If you have certain types of injuries, even if you're very darn strong, you still can't do it. But then if you have an injury mechanism that is neutral to it or beneficial and the rest of that chain can handle it, then hanging is a great tool.
Got you. Makes a lot of sense. And I assume the prescription would be to start with just a very, very minimal amount and build your way up.
Yeah, well, I would say that could be true. I mean, if traction is beneficial to you, hanging is actually kind of like a pretty big dose of traction. So it could be a case where your spine likes some traction, and then there's tools like that where you could kind of do it on a bench where your kind of feet are still lightly touching the ground.
Sure.
So then that's called a park bench decompression is a tool. And then another is some of these band holds. If you're holding a band downward, there's a gentle upward decompression force. So sometimes it's really a matter of, the degree of the force and how much of it you're getting.
Yeah, absolutely. Makes a lot of sense because it kind of gives me the idea of when people do pull-ups as a warm-up for the lat pull-down, for example, but not recognizing that they're actually pulling up about between 60 and 90 kilos of weight, which is way more than just a gentle warm-up. So I get that concept entirely. And Lysander, this has been a super interesting conversation. I'm going to wrap up with a couple of final questions. The first is, what impact do you want to have on the world with the work that you do?
I want people to have a better idea of things that will make them healthier, and hopefully kind of in doing so be able to kind of lead a more functional, richer life.
I love that. And where's the best place for people to find you if they want to keep up with the work that you're doing?
It would be my website, masterymedical.com, or if they want to check out my book, it's available on Amazon as well as my website.
Amazing. We'll make sure that all of that is in the show notes below. But Lysander, thank you so much for your time today. Thank you for your insights. I really appreciate the work that you do.
Hey, thank you for your time. It was a lot of fun.